Greetings, this is Dr. Douglas Maurer from iMedical Apps with another medical app review. Today, we're going to be taking a look at a new SBIRT app. This app comes from the University of California in San Francisco and I'm just going to call it the UCSF SBIRT app. It's technically from the Open Health Network is who actually created the app. If you remember from my app review last year, we had another app from the Baylor School of Medicine just called SBIRT, and it kind of walks you through the steps. So for those of you who are not familiar with SBIRT, well, here you go. Screening, brief intervention, and referral for treatment for substance abuse. So this typically is used for both tobacco use, alcohol use, and any illicit drugs. The app, as you can see, is laid out pretty simply. It has one of the things that you'll see in my negative side of the app is it wants you to tailor the app. I've attempted to complete this several times and it keeps hanging on the last few questions. So we're going to say not now, but otherwise if you say tailor now, it will walk you through a number of questions that it wants you to answer, kind of a pre-test, if you will, or pre-assessment. You can see I get hung on question 19. A little bug in the app they'll have to fix, but the app works fine if you just ignore that, and perhaps if I keep trying, it will eventually let me through. But for those who are not familiar, it walks you through essentially a curriculum on SBIRT. In my written review, you see some links to online curricula, both one available through Medscape, one through UCSF, and one through Baylor School of Medicine. But this walks you through the epidemiology of our current struggles with drugs, alcohol, and tobacco, consequences of this, all about SBIRT itself, evidence for SBIRT. You can navigate by going back here or going to the home page here. Let's go back to our review section. You can see lots of information on step-by-step how to perform an SBIRT evaluation and intervention, tips on motivational interviewing, which is essentially what SBIRT is a type of motivational interviewing. It has information on how to refer patients, including the referral process. There's links to where to review, and what I love here is there's actually video modules of how to do SBIRT evaluations built right into the app. When you're ready to actually start doing it, it has the screening questions built right in. So if you're going to start a new screening, it asks you what you're going to screen for, alcohol, drugs, etc. Let's say drugs, put in the demographics of who we're evaluating, hit continue, and it walks you through the steps. So you can do a single question drug. We'll just say it's one time. And it says that you're at risk and you should continue with a further assessment. It then walks you through how to do that process, including advice on how to conduct it. It has scripts built into it. It's really pretty awesome, all the information that is baked into it. Then under report, the app, since this was designed clearly by UCSF with the intent of helping providers that it trains in SBIRT to go out there and do it, it has information on, well, how are you doing as a provider? What's your confidence level? A lot of this questionnaire is pretty nifty, but at times it seems like it gets in the way of the app. But it's there, SBIRT usage, app usage, a lot of reports that can be generated and tracked, which is kind of a high-tech way of doing it right from the app. Then there's all these tools, so there's like a social aspect to this. So if you're providing SBIRT, you can ask questions to others who have the app and are part of this network, so that's pretty nifty. You can also see support for the app, of course, technical questions, who's using the app the most, that information is listed in here. So that's my quick look at the SBIRT app from UCSF. Just to show you, though, the other app that's out there, this is the SBIRT app from Baylor School of Medicine that I reviewed last year. It's much more simple in the sense it doesn't have all of the background information. If you just want to do a complete SBIRT interaction on an adult or a child, it just walks you through step by step and guides you through the process. You can type in answers, has some basic information about the app, the actual surveys, etc. Granted, you've got to complete it to do it. And it has some basic information on how to do it. I love how it has these rulers built into it. So that was a review I did last year that you can look up online. Going back to this one, so things I liked about this app, obviously it uses SBIRT, which is evidence-based, and so that's fantastic. The guides here kind of walk you through the process if you're not really sure how to do it. Well, it has all of these resources here to walk you through the process, narrated modules even on how to do it, which is not available in any other app at the moment. Some things I didn't like about the app: if you just want to get down and do an SBIRT intervention, well, you kind of have to dig around to figure that out, whereas on the other app, it's pretty straightforward. This app is currently only available for iOS and not Android. And there aren't really any directions built into this app. You just kind of have to figure it out. So that's my look at UCSF SBIRT. This is Dr. Douglas Maurer from iMedical Apps. Take care.